Dr. Leif Loberg joins us on the set now, and he's located right off Paseo de Valencia and real close to Laguna Hills. You've been in that area for quite some time now, right?
I have,
Yeah.
yes.
It's right across, is it Gate 4 over there?
From Gate 4, exactly, in the Laguna Hills Medical Arts Center.
Now, you actually are a sponsor in the 50th anniversary golf tournament, and that kind of tells you, the partnership that your practice has with our community.
Absolutely. One of the beliefs that we have is our continuous giving spirit, and at all opportunities we try and really return to the community our efforts and.
It's a great partnership.
It's fantastic. I mean, the people of Laguna Woods have been just terrific.
Yeah.
And it's a small gesture, a small token of appreciation to just say thank you.
Mm-hmm. Now, you're a hockey player, so how good a golfer are you?
Not bad. I used to be a single handicap, but with the kids,
forget it. Yeah.
The golf game gets a little rusty.
It becomes double and triple at that point.
Yeah,
Geez.
absolutely.
Yeah. Well, golf is obviously a fun time, and we're looking for a great event here next week. Hopefully we get some more or cooler temperatures here next week so everybody can enjoy it. But let's talk about your practice a little bit. You have a lot of interesting things that are coming about with, again, technology and not in the dental field.
We have. Lately, we actually had an article published in the Wall Street Journal called the Mo2 Maneuver and its application to the All-in-4 protocol, which basically means that you can take someone's teeth, whether they've lost all of their teeth, whether they're broken down, decayed, to be able to take them out, replace them with implants, and the exact same day deliver a full set of teeth with a perfect bite, perfect color,
right,
and send them on their way.
So our viewers might be familiar with an implant that we've seen in newspapers lately, an implant for $1,000 or $600, whatever it might be. But it's usually one tooth. But what you're talking about is the complete upper and lowers, possibly, if you did it that whole day. But it's, what, 3 or 4 implants instead? And then it's all of them, the teeth, basically?
Exactly. So it's typically 4 implants. More when needed, but typically 4 implants and a full arch of teeth. So it's
amazing.
It's amazing. It's an engineering marvel, really, and it's revolutionized the way that we practice dentistry today. The old way, which is to take someone's teeth out and make a denture, versus the new way, which is to take someone's teeth out, implant 4 implants, and attach a non-removable set of teeth is night and day.
So right away they'd be able to eat corn, have steak, eat what they normally would, probably what they've been missing and eating in the last few years. And the teeth are just as durable and last just as long?
Just as durable. It's a permanent lifetime solution.
Wow.
And yes, they absolutely can. The first 6 to 8 weeks after the surgery, we modify a patient's diet so that they eat things that they can cut with a plastic fork, something soft. But outside of that, after that healing period, they're away to the races and can enjoy those filet mignons.
Yeah, and I imagine the healing period during that time is really the sensitivity in the gums, getting used to the implant?
Typically, it's actually the biology of the bone. The bone is a more slower healing, slower growing tissue than gum tissue. And that's really all we're waiting for.
What other new advances do you see coming down the line? Obviously, this is something new, and you'll be focusing on that for some time. But I mean, there's so many new things that come about with science and technology that I imagine the dental practices are benefiting from that as well.
They are. One of the amazing things that have come about within the last couple of years is 3-dimensional cone beam topography, which is a huge word to basically say that we have a way to look at the inside of the bone in a 3-dimensional way.
Wow.
So that's a huge advance.
It's not the cardboard in your teeth and your mouth and you're trying to bite down.
No.
It's something different, right?
And I think the next huge advance will be actually implanting teeth with stem cells.
No kidding. Very interesting. Well, we're looking forward to some of these new advances. You're located right across the street, like we said, in Gate 4. You're right on Paseo de Valencia, and you take new patients regularly?
Yes, we are now accepting new patients. We have a very busy practice. I tell everybody it's a carnival. When they come, it's where all the cool people hang out.
There you go. And you'll see cool stuff like this. Is this something similar to what you were talking about, this 3D modeling?
Yes, this is a three-dimensional image of a design of a tooth. We have a CAD/CAM milling unit in the office where we can scan using a laser and recreate a tooth three-dimensionally.
Yeah. Well, I've known you for a little while. You're kind of a gadget guy, but you really invest in technology and step out there and look at some of these advances and bring them to your practice right away.
Absolutely, and you know, I think from a patient's point of view, you know, you certainly wouldn't want to see a doc that's, you know, behind the times and not willing to make those investments into their patients and into technology to give them the best that we possibly have.
And that's just it. You know, the patient will, you know, benefit in, you know, the healing process. You know, I imagine you can see them quicker. They'll get their, you know, whatever they might be getting done while they come see you, get done a little bit quicker because you have these advancements in front of you that then can help them, really.
Absolutely, and that I think is one of the cardinal developments with the Mo2 maneuver and the all-on-4 concept.
Right.
It's really revolutionized how you can remove teeth and deliver a perfect bite at the end of a surgical session.
Yeah. And you said that was in the Wall Street Journal. So if someone was to Google Wall Street Journal and how do you spell that? Mo2?
Mo2 maneuver, Mo squared maneuver.
Okay.
That's what it's called.
Okay, so if you have a chance, Google that on Wall Street Journal. You'll be able to see that article. And I imagine then in the next few years we'll be hearing more about, you know, something like that.
Absolutely.
Great.
Absolutely.
Well, thanks so much. We know the community appreciates you helping sponsor this annual golf tournament and the 50th anniversary celebration that's going to be going on next week. That's going to be on September 12th down at the golf course. All the tee times are full, but if you'd like to join everybody for lunch, they do have some lunch tickets available still, so be sure and give a call over to the Village Greens. And of course, if you'd like to be a patient with Dr. Loberg, be sure and give him a call at 586-1930, located right across the street from Gate 4 on Paseo de Valencia. Well, thanks so much for joining us. Sounds like some very exciting things coming your way, and we look forward to seeing what new technology, you know, can help our patients in the future as well.
Thanks so much.
That's Dr. Leif Loberg, and he's with Loberg Dental. We'll be back with more of This Day right after this. Good job.
Cool.
Here at Loberg Dental, we are so excited about our new CAD/CAM machine. You, as a patient, come in, we prepare your implant, we design it on the center, send it to the mill, and make in-house your implant tooth. No temporaries, no impressions. You'll leave with your permanent tooth all in the same day.
Available from Loberg Professional Dental Corporation. Call 949-586-1930 or visit drloberg.com.